Hey everyone, and welcome back. Today we're diving into a topic that may not seem all that exciting at first, but believe me, it's more interesting than you might think. Suctioning.
You got it. Suctioning. Might not be the most glamorous procedure, but it's absolutely essential in respiratory care.
Yeah.
It can truly make or break a patient's outcome.
You know, I was really surprised by some of the things I came across while getting ready for this deep dive. Stuff like how dangerous it can be if you use a suction catheter that's too big. And get this, the link between suctioning and the pressure inside the brain. There's even a real art to making sure the patient has enough oxygen even before you start. But before we get ahead of ourselves, maybe we should start with the basics. Why is suctioning even necessary?
Okay, so it all boils down to what we call retained secretions. Our airways, you see, they're always producing mucus, right, to trap those foreign particles, keep everything running smoothly. But sometimes, especially when someone's sick or injured, these secretions can build up, and that's when they start causing problems, big problems.
So kind of like when you have a cold and your chest feels all, congested.
Exactly. But now imagine that feeling magnified, much worse. These retained secretions, they can make it really difficult to breathe. And that can lead to low oxygen levels in the blood hypoxemia. It's almost like trying to breathe through a straw that's clogged with thick mucus.
Oh, that sounds terrible. And I think I read in one of the articles it can even make parts of the lungs collapse.
You're right. That's called atelectasis.
Yeah.
And on top of that, all that gunk just sitting in the airways, perfect breeding ground for bacteria, increases the risk of pneumonia and all sorts of other infections.
Okay, so retained secretions are definitely not our friends, which brings us to the when of suctioning. How do we know when it's time to step in and clear those airways?
Well, it comes down to careful observation. You gotta know the signs. You can't just rely on hearing noisy breathing. No, you have to look at the whole picture. The patient's breathing patterns, their vital signs, even lab results, like ABG values, which tell us about the oxygen and carbon dioxide levels in their blood, is a holistic approach.
One of the sources talked about a sawtooth pattern on something called a flow volume loop. What exactly is that?
That's a great example of a visual clue we look for. A flow volume loop. Think of it like a graph. It shows how air moves in and out of the lungs. And if we see that jagged sawtooth pattern, good indication that something's blocking the airways. Could be thick secretions,
So it's like looking at a map of the airways and seeing a traffic jam.
That's a great way to put it. And in addition to these visual clues, we also look for signs of aspiration. That's when food or liquid gets into the lungs by accident. And of course, if the patient is showing signs of respiratory distress, well, that's a clear signal that we got to intervene.
Okay, so knowing when to suction is as crucial as knowing how to do it right. And speaking of doing it right, let's walk through the actual procedure. I have to say I was a little intimidated by all the equipment involved. It's like a whole toolkit.
Yeah, you're right. There are quite a few components. You have your suction source, the tubing, a collection canister, and of course the suction catheters themselves. And before we even touch any of that, we have to make sure everything is clean, sterile, to prevent infections.
It's like prepping for surgery, but for mucus. I was also really interested in the different types of catheters. One article mentioned something called a Coud tip catheter. What is that?
Yes. A Coud tip catheter. It's specially designed with a slight bend at the tip. It's really helpful for navigating those twisty airways, especially if we need to reach the left main bronchus. But, no matter the tip design, choosing the correct catheter size, that's crucial.
And there's a formula for that, right?
Yeah.
Something about doubling the inner diameter and then going with the next size down.
Exactly. It's so important to remember, a catheter that's too large can cause just as many problems as one that's too small. We got to find that Goldilocks zone, effective suctioning without causing any harm.
Yeah, makes sense. You don't want to be jamming something too big in there. So we have the equipment ready, the right size catheter. What's next?
Before we insert the catheter, we pre-oxygenate the patient. So we give them 100% oxygen for at least 30 seconds.
Why is that step so important? It seems like you could just, suction quickly and be done with it.
Well, even though suctioning itself takes only a few seconds, we're basically stopping the patient's breathing during that time. So by pre-oxygenating, we're topping up their oxygen levels, preventing a drop in blood oxygen while we're suctioning.
So it's like giving them a deep breath before they hold their breath underwater.
Perfect analogy. And once we've pre-oxygenated, we can gently insert the catheter into the airway.
And then just suck everything out.
Well, not so fast. It's a bit more delicate than that. We never want to apply suction while inserting the catheter, because that can really damage the lining of the airways. They're very delicate.
Okay, so insert the catheter without suction, and then what?
Once we feel resistance, we gently withdraw the catheter just a bit, and then we apply suction, but intermittently as we're pulling it out. We use a twisting motion to help loosen those secretions. And super important to remember, we never suction for more than 15 seconds at a time.
15 seconds. Doesn't seem like a very long time.
It's all about finding that balance, effectiveness, and safety. Suctioning for too long? Well, it can actually lead to complications. And you know what? We're going to dive deeper into those potential pitfalls right after this.
We were talking about how to actually do suctioning before, and it's a lot more complex than I thought, but even if you do everything perfectly, can things still go wrong?
Well, unfortunately, yes. Like any medical procedure, there are some risks, some things that can happen. But being aware of those risks, knowing how to handle them, that's key to giving safe and effective care,
So what are some of the things that can go wrong?
One of the most common is hypoxemia, a drop in blood oxygen. We talked about pre-oxygenating the patient to prevent that. But even with that precaution, it can still happen sometimes.
How does that happen? You'd think removing, gunk from the airways would make it easier to breathe.
Yeah, you'd think so, right. But the act of suctioning itself, it can temporarily mess with that normal flow of air in and out of the lungs. It's a little like if you were, snorkeling and someone suddenly pinched your snorkel tube closed for a few seconds.
Okay, I see. So what do you do if the patient's oxygen levels start to drop during suctioning?
First things first, stop suctioning immediately. Then we give them supplemental oxygen as needed, and we monitor their vital signs closely, of course. Sometimes we may need to think about more advanced interventions, like mechanical ventilation.
Makes sense. What about other complications?
Another one to keep in mind is bradycardia. That's a slowing of the heart rate. This happens because suctioning can, stimulate the vagus nerve, and that nerve helps regulate heart rate.
Can you actually see that happening, like during the procedure?
Oh yeah, we're always keeping an eye on the patient's heart rate and rhythm during suctioning. If we see a sudden drop in heart rate, we stop right away, of course, and take steps to support their circulation.
I was reading about a possible link between suctioning and increased intracranial pressure, ICP. That sounds really serious.
It is, yes. Increased ICP is essentially a buildup of pressure inside the skull, and it can be really dangerous for patients who are already neurologically compromised.
Yeah.
Like folks with brain injuries or certain neurological conditions.
But how does suctioning even affect pressure in the brain? It seems like two totally separate systems.
Right. They're separate systems, but they're connected.
Mm-hmm.
When we apply suction, it creates this negative pressure in the chest cavity. Yeah. And that can have a ripple effect throughout the body.
And that ripple effect, it can reach all the way to the brain.
Yes, exactly. Right. This negative pressure can affect blood flow, including the blood returning to the heart from the head, and this can cause a temporary increase in ICP, which in most cases is mild and goes away quickly.
But in some patients, even a small increase in ICP could be dangerous, right?
Absolutely. That's why we need to be aware of this potential complication, especially when taking care of those patients who are at higher risk.
So how can we minimize the risk of increased ICP during suctioning?
One strategy is to pre-treat the patient with a topical anesthetic, like lidocaine, about 15 minutes before we start. This can help numb the airway, reduce that cough reflex, which can contribute to the pressure increase.
Oh, interesting. I wouldn't have thought to use a numbing medicine before suctioning.
It can make a big difference, especially for sensitive patients. And of course, careful monitoring, it's essential. We're always watching for any signs of neurological changes, like changes in mental status or pupil size.
And if you see those signs, you stop suctioning immediately. Right?
Absolutely. Better safe than sorry, as they say.
We've been talking a lot about complications, but it's important to remember the incredible benefits of suctioning when it's done correctly.
That's a really good point. It's easy to get caught up in the what ifs.
Yeah.
But suctioning, it can be a life-saving intervention. It's not all doom and gloom.
Right. It helps people breathe, get that oxygen they need, prevents those lung infections.
And it's not just physical benefits. Think about how distressing it must be for a patient to feel like they're drowning in their own secretions, unable to clear their airway. Suctioning can give immense relief from that, improves their comfort and overall well-being.
It's like giving them back control, being able to breathe freely again.
Exactly. It can be a powerful moment for both the patient and the caregiver.
And there's another type of suctioning we need to talk about, nasal suctioning. I know this is pretty common in, babies and young kids. Adults can need it too, right?
Yeah, that's right. Nasal suctioning is often used for infants, young children who can't clear their nasal passages on their own very well. But it can also help adults who have conditions that block their nasal airflow. Things like a deviated septum or nasal polyps.
So the goal is the same as with other types of suctioning, right? To remove those secretions. But the technique is a little different, isn't it?
Yes. Instead of using a sterile catheter, we use a soft, flexible one. It's lubricated with a water-soluble jelly. This helps to, reduce discomfort and prevent trauma to the delicate nasal tissues.
So it's a lot gentler than using a rigid catheter.
It is. But even though nasal suctioning might seem, like a simple procedure, we still have to do it correctly to avoid complications.
What kind of complications can happen with nasal suctioning?
Well, just like with other types of suctioning, there's a risk of hypoxemia, especially in infants. And we got to be super careful not to insert the catheter too forcefully, because that can cause bleeding or damage to the nasal tissues.
I remember when I was a brand new nurse, I was suctioning this tiny baby's nose, and, well, let's just say things got messy.
Oh, I bet.
It was like a mucus volcano. But thankfully, the baby was fine. I learned a good lesson about, being gentle.
That's so important. Even seemingly simple procedures, they can have unexpected consequences if we're not careful.
Okay, so we covered the basics of nasal suctioning, but are there any other things to keep in mind?
One thing is nasal suctioning isn't always the right call. Like if a patient has a skull fracture, for example, or a recent nosebleed, it could be really dangerous.
So know your patient's history and any contraindications.
Exactly. And like with other types of suctioning, careful monitoring, proper technique, those are key to keeping the patient safe and making sure the procedure works.
We talked about best practices, but are there things you should avoid doing during suctioning?
One thing that used to be common practice, but we generally don't do anymore, is routinely putting saline in the airway before suctioning.
Really? I thought saline helped to loosen up secretions.
Yeah, that was the thought. But studies have shown that putting saline in can actually be harmful. It can increase the risk of hypoxemia, trigger coughing, and even mess with the natural defenses of the airways.
So unless there's a specific reason to use saline, like if the secretions are really, really thick, it's better to avoid it.
Exactly. Good example of how even long-standing practices in healthcare need to be reevaluated. See if the new evidence supports it.
Always learning. So another thing that I was curious about was the different suction catheter tip designs. We talked about the coated tip, but what are some other options? How do you know which one to choose?
It's like a whole menu of options. You've got straight tips, curved tips, whistle tips, besides the coud. The choice really depends on the anatomy of the airway, where the secretions are, and the patient's needs. What's right for one person might not be right for another.
So not a one-size-fits-all situation.
Definitely not.
Yeah.
Like everything else with suctioning, we got to use our knowledge, our judgment to pick the right tools, the right techniques. It's all about the patient in the end.
It's amazing. Something that seems so simple, like suctioning, is actually so complex. There's so much nuance.
It really is. And it just shows the skill, the expertise of the respiratory therapists, the nurses, all the healthcare pros who do this every day.
They're the unsung heroes,
Couldn't agree more. They're vital. They help patients breathe easier, live better lives. It's important work.
We've covered a lot in this deep dive, everything from the actual techniques to the complications, even how it can, impact the patient emotionally. It's a lot to think about.
Yeah, it really has been a journey. I think we've both come to appreciate this procedure. It's often overlooked, but it's so essential.
Absolutely. But before we wrap up, I'm curious about the future of suctioning. What advancements, might change the way we approach it in the future?
That's a good question. Respiratory care is always changing. Right?
Yeah.
And I bet we'll see some really cool innovations in suctioning too. It's an exciting time.
One thing that comes to mind is like smarter suction catheters. What if a catheter could sense how thick the secretions are and adjust the suction pressure, automatically?
That would be amazing. No more guesswork.
Yeah.
And it could really help reduce the risk of trauma to the airways. And speaking of reducing trauma, there's a lot of research going on right now, looking for less invasive ways to deal with secretions.
Like what?
Well, one promising area is something called vibratory positive expiratory pressure, or vibratory PEP. They use a handheld device, and it vibrates the chest wall while the patient breathes out. And those vibrations, they help to loosen up the secretions, get them moving without needing a catheter.
That sounds a lot gentler.
It is.
Yeah.
And for certain patients, especially those who are very sensitive to suctioning or who are at high risk for complications, this could be a real game changer. I'm excited to see where it goes.
I'm also thinking about telemedicine. Could we one day see respiratory therapists remotely, monitoring a patient and guiding other healthcare providers on suctioning techniques through like a video call?
Oh, I think that's definitely possible. With all the advances in remote monitoring technology and telehealth platforms, I think we'll see a shift, towards more proactive, more personalized respiratory care. And suctioning, that'll just be one piece of the whole picture.
So many possibilities, but I think one thing will always be important no matter what the future holds, and that's compassionate care, putting the patient first.
Absolutely. I agree. Whether we're using fancy new technology or a simple suction catheter, our focus should always be on providing the best care we can for each individual patient. Respecting them and their needs. That's what matters.
So as we wrap up this deep dive into the world of suctioning, we hope you've learned something new, that you see this procedure a little differently. It might not be the most glamorous part of healthcare, but it's so important. It helps patients breathe easier, live better lives.
It's been great, exploring this topic with you.
And to all of you listening out there, whether you're, a seasoned pro or just starting out in healthcare, remember, there's always more to learn. Keep asking those questions. Keep challenging those assumptions. And always, always keep striving to provide the best possible care for your patients. That's what it's all about.
And until next time, stay curious, stay compassionate, and keep on diving deep.